Is there an age after which a plastic surgeon should not operate? I have found a lovely experienced oculoplastic surgeon to perform blepharoplasty, but am a little concerned as he is in his 70s and work around the eye is so delicate.
Thank you for your question. You're asking if there is an age after which plastic surgeons should not operate. And you describe in your question that you met a very nice oculoplastic surgeon who's in their 70s, and you're concerned about the surgeon operating around your eyes, as you stated that the eyes are so delicate. Well, I can certainly give you some perspective as an insider in the field of oculoplastic surgery. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculoplastic or oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I specialize in delicate eyelid surgery every day of my practice. So I think that your question in many ways has a certain obvious relevance, but I would say that age is probably not the limiting factor when it comes to making this type of decision. I have met throughout my career many doctors who are well in their 70s in different specialties, not just oculoplastic, but general plastic surgery, otolaryngology, dentistry, who are very good at what they do. And I think that when someone feels that they're just not being able to do what they once did very well, they will naturally start to slow down. I think that reality is that the person who is in their 70s and is practicing and is comfortable practicing, you are probably, if you feel comfortable with this doctor, then I don't think you should have that concern. If you don't see any signs that the doctor is not going to be able to do the operation the way you like, then of course you should ultimately make a decision. But I have I have many colleagues who I personally know who are very, very good, who are operating in their 70s. It's a kind of a funny thing. There is a time in one's career where people may feel that you're too young to operate on them, and then there is, of course, the time when people may feel like you're too old to operate. But I think that, yes, there are going to be the occasional doctor who is still operating and their skills are not where they should be or where they were. I think that doctors who are ethical and who are real masters of the craft will know when there's a time to make these decisions. And a lot of times it's not just about age. Sometimes you just feel like you just don't want to do certain procedures because whether it's the physical stress or whether it's the time that it takes to do certain procedures. So I think that I think one of the things you may want to do is just talk to the office staff, and most of the time the office staff will be you'll be able to read them and be able to tell if they feel that the doctor is very confident and comfortable. In my practice, my own office staff has many of them I've operated on not just once but several times for different reasons over the years. And even when new employees come in, very often I end up doing procedures for them or procedures on their family members. That's a real vote of confidence. It's very meaningful to me that the people who work with me in my practice have that level of confidence in me and want me to be the doctor for themselves and their family members. So, you may want to just ask if an office, somebody who works at the office, if he was going to operate or she was going to operate on your family member, would you be comfortable with that? And I think if you read the reaction as being, being unquestionable, then I think then you don't have to worry about it. Like I said, I think that just as we are all getting older, but with age, there's a significant group of people who still are very healthy, very strong, very sharp, and very inspired to keep working in their chosen profession, then I don't think you have to be concerned based on the age alone. So I hope that was helpful. I wish you the best of luck. Thank you for your question.